Hi guys, Benji at Benji Physio. Today we are going to look at the problem that we see in a lot of runners. It's lateral hip pain. It is part of the top 5 of the problem we will see with runners. So lateral hip pain is all those pain you feel on the outside of your hip, and it's generally related to deficient gluteus medius muscle. So that muscle is a muscle that is on the side of your hip that is going to start from a big bone called the ilium and will attach onto that hippy bone there you can feel on the outside of the leg called the greater trochanter. And that muscle is there to help you to do what we call a hip abduction, which is making you do this movement. But more importantly, this muscle is there to stabilize your torso, your pelvis, when the other leg is elevated or elevating. So it means that when you are walking and you are just putting your right foot on the floor, your right glutes med has got to contract very hard, do a very big isometric eccentric force to try to maintain your pelvis in that position to allow the left foot to come forward. So as soon as this muscle is a bit weak, you are going to start to feel some pain on the outside there. Generally just above the greater trochanter, on the hippy bone there, but often as well a bit higher up in your lower back. And I've seen even some people who have had more degeneration into that tendon. The tendon was inflamed, had a tendonitis, and then finds the glute maximus, which is a big glute muscle there, started to be weak, and those patients getting that kind of deep pain into the buttock. So why does it become weak? Well, that's quite complicated. So the first reason is obviously could be just due to following a fall, hit right on the greater trochanter, got a bit of inflammation, a bit of bruising in the area, you're not using that muscle as well, it becomes weak, it then becomes inflamed and you get pain. But generally, in runners, it's a wee bit more complex than that. We are going to obviously have the group of patients who started to do a lot more running or change the training. I know you've heard that a lot when we're speaking about tendon, but that's what tendons do. Tendons don't like changes. As soon as you increase your training or decrease your training, because that has been shown quite recently, you are more prone to get a tendonitis. And the glutes med tendon is not going to just be any different. It will get injured when you change that. What I see a lot as well is when patients go back to running after an injury. So that's obviously increasing the training. And somehow we think about your hamstring, we think about our calves, in our quads when we walk, but we never think about your hip muscle there, and we are not thinking at all in our core. And what's happening? We just go back running, we increase our mileage, and because we don't strengthen that muscle well enough, we're starting doing those kind of movement, and that over time is causing a lot of pain. So the first thing we need to do is to strengthen that tendon properly to try to make it better. And I will show you later on some of my favorite exercises for that. Another cause of problem is when the hip goes in a wee bit too much, okay? And that will be caused generally because you have had an injury to your leg, the knee, the ankle, a calf tear, and you suddenly decrease your general strength in all your body, and for one reason or another, biomechanically, your knee comes in, okay? And when it does in, your glutes muscle become overstretched. Your glutes muscle generally helps you with abduction and extension. And as soon as they become weak, or other muscle in your leg become weak, your knee starts going a bit in, they're overstretched, they don't like that, they become sore. I've seen a lot of problems like that as well, of this kind of pain on women after going back to running after a pregnancy. Obviously, your abs are not as good as they used to be, and you just go back running, not having worked enough on your core, and you start running and you're just starting to move a bit too much. Your core is not helping you to stabilize your pelvis. You rely way too much on that muscle and it becomes inflamed because of that. So as you see, there are a lot of things we need to look at. I didn't mention as well on top of that any kind of ankle problem. As soon as your ankle turns in due to an injury or a change in hormones, as we see for ladies around 45, your ligament become a bit more lax, so your arch tends to fall a bit more, and that change all the biomechanics. Your arch falls, your knee goes in, your hip turns in, and automatically your glutes become a bit painful. Glute med tendinopathy can be confused very often with sciatica or back pain. It can be confused with an SIJ problem or any kind of hip, OA, osteoarthritis or impingement. Okay? The main difference between all that is in sciatica, for example, is you are going to get a pain coming down the back of the leg to the calf, and obviously some back pain. SIJ pain, if we believe that there is a lot of movement in the SIJ, which is another discussion, will generally cause pain around the sacrum area and come to the side, and very often will come at the front as well, with very often a lot of pain coming down on the outside. And when you've got hip osteoarthritis or impingement, you will get that pain there as well, but it is going to feel very, very deep when the glutes med injuries tends to be more at the surface of the joint. And on an impingement and OA problem, you are going to get a lot of growing pain with generally a reduction of range of movement. We don't automatically see as much with patients with glutes med. Obviously, that is the theory. It can change a bit into practice.